The Center for Healthcare Quality and Payment Reform estimates that 734 rural hospitals in the United States, one-third of all rural facilities in the nation, are at risk of closing as of January 2026. Becker's Hospital Review reported 4 hospital and emergency department closures in 2026 so far, including one in Arkansas that is permanently closing its emergency department today, April 15th, the day this video was published, and another in Pennsylvania that will shut down its inpatient and emergency services by May 17th. A hospital CEO in Indiana named Brenda Reitz said Medicaid and commercial insurance pay so far below the actual cost of care that we could no longer sustain the OB unit, and this was a heartbreaking decision for our community. In Virginia, a hospital closed its labor and delivery ward, citing recently enacted reductions in federal health care funding, and Public Citizen documented that over 500 health care providers across the country are either closing or at risk of closing as a direct result of the One Big Beautiful Bill Act. And the National Governors Association reported that governors across the nation, Republican and Democrat, expressed serious concerns about shortages in healthcare workforces, hospital closures, and worsening health outcomes for families who no longer have access to care near their homes. The governor of Kentucky said we cannot accept a future where a Kentucky woman must travel several hours to give birth. 75% of North Dakota's rural counties face primary care shortages. And I need to tell you something about these closures that fundamentally changes how you should think about what is happening in the next 90 days. When a hospital closes, it does not reopen. When an emergency department shuts down, the community does not get a new one. When a labor and delivery ward is eliminated, the babies who would have been born there are born in ambulances or cars on the highway, driving to a hospital that is an hour or 2 hours away. Or they are not born safely at all. These closures are permanent. They are irreversible. And in the next 90 days, more of them will happen. And each one breaks something in a community that can never be repaired. That is what this video is about. Not the things that will hurt you temporarily, the things that will be destroyed permanently. The hospitals that will close and never reopen. The healthcare workers who will leave and never return. The trust that will shatter and take a generation to rebuild. The middle-class families who will cross a threshold from which there is no path back. Because the difference between a crisis and a collapse is that a crisis ends. A collapse leaves wreckage that stays, and the wreckage that is about to be created in the next 90 days will define the America that your children and grandchildren inherit. Not the America you grew up in, the one that comes after. The healthcare infrastructure that took 50 years to build is being dismantled in months, and once it is gone, it does not come back. Boston University School of Public Health said the loss of a rural hospital is devastating for a local community, and they documented that 50% of America's rural hospitals are operating in the red, and the approximate $1 trillion in Medicaid cuts under the OBBBA is expected to eliminate insurance coverage for at least 17 million people by 2034, including 2 million in 2026 alone, and the $50 billion Rural Health Transformation Fund that was supposed to soften the blow covers barely one-third of the estimated loss of federal Medicaid funding in rural areas. And the Trump administration proposed in its fiscal year 2027 budget request a 12.5% decrease in HHS funding, a $102 million decrease in funding for the Federal Office of Rural Health Program, and the elimination of state offices of rural health entirely. Every one of those programs exists because rural health care cannot survive on market economics alone. The patient volumes are too low, the distances too great, the payer mix too heavily weighted toward Medicaid and Medicare, and the staffing costs too high relative to the revenue the facility can generate. Without federal support, these facilities close, and when they close, the doctor leaves, the nurses leave, the pharmacist leaves, the lab technician leaves, the specialized equipment is sold or transferred, and the building that housed them sits empty or is converted to something else. And the community that depended on that facility is left with nothing. No emergency room, no operating room, no maternity ward, no radiology, no pharmacy, nothing within 30 or 60 or 90 minutes of driving. And the American Hospital Association's 2026 workforce scan documented that rural and underserved communities face the steepest shortages and that hospitals are no longer relying on the workforce to simply rebound. They are rebuilding from the ground up. But you cannot rebuild what was permanently destroyed. You cannot reopen a hospital that was sold for parts. You cannot rehire a surgeon who moved to a city. You cannot reconstruct the trust of a community that watched its hospital disappear while the government told them that $50 billion would be enough. It was not enough. It was one-third of what was needed. And every week that passes in the next 90 days is a week in which another rural hospital, another maternity ward, another emergency department makes the decision that cannot be unmade, the decision to close. And once that decision is made, the infrastructure that served that community for decades is gone. Not temporarily, permanently. The healthcare system that Americans over 50 grew up trusting, the one that was supposed to be there when you needed it, is being disassembled. And the disassembly is accelerating, and the pieces once removed do not go back. The healthcare workers who are leaving the profession are not coming back, and the shortage they leave behind will kill people for decades. One analysis projects a shortage of up to 3.2 million healthcare workers by 2026. Another projects a shortage of 73,000 nursing assistants by 2028. Over one-third of nurses will reach retirement age in the next 10 to 15 years, and the mass layoffs in the healthcare industry are accelerating, not slowing. Providence cut 450 staff in Washington and Oregon. Oak Street Health, part of CVS, cut 219 jobs and closed 16 primary care clinics for seniors. Tower Health in Pennsylvania laid off 350 workers. Optum terminated 572 jobs and closed 90 clinics across New Jersey. Peace Health laid off 400 workers across Oregon, Washington, and Alaska. And roughly 10,000 full-time jobs were cut at the Department of Health and Human Services, including 4,300 at the CDC, one-third of its workforce. And here is the part that makes this irreversible. A nurse who is laid off does not sit at home waiting to be rehired. They leave the profession. They take a job in pharmaceutical sales or medical device companies or insurance administration, or they leave healthcare entirely and work in technology or education or retail because the salary is competitive and the emotional trauma is absent. A study found that 47% of healthcare workers who left their positions during or after the pandemic said they would not return to clinical care under any circumstances. And the pipeline to replace them is broken. It takes 4 years to train a nurse, 7 to 10 years to train a physician, 15 years to train a specialist, and the medical school loan forgiveness programs that incentivize students to practice in underserved areas were cut in the OBBBA. And Time magazine published an assessment that said what 2025 exposed is that the U.S. healthcare system is officially broken. Not stressed, not strained, broken. And a broken healthcare system does not heal itself. It requires investment, policy, and time. And the investment is being cut. The policy is being driven by budget reduction rather than care improvement. And the time that would be needed to rebuild what is being destroyed, a minimum of 10 to 15 years, means that the decisions made in the next 90 days will determine the healthcare reality for an entire generation of Americans. The hospitals that close in May and June of 2026 will not reopen in 2027 or 2028 or 2030. The nurses who leave will not return, the doctors who relocate will not come back, and the patients who die because the nearest emergency room is now 90 minutes away instead of 15 will be dead permanently. That is what irreversible means. It means the damage does not undo itself. It means the community does not recover. It means the family that loses a parent or a grandparent to a heart attack that would have been survivable if the hospital had not closed carries that loss forever. And there is a compounding effect that most people do not see. When a hospital closes, the pharmacies and clinics and medical supply companies that depended on the hospital's patient volume also close. The physical therapist who served rehabilitation patients from the hospital loses their referral source and relocates. The home health agency that received discharge orders from the hospital loses its pipeline and reduces staff. The ambulance service that transported patients to the hospital sees its call volume change and its response times extend because the destination is now 30 or 60 miles farther. The entire healthcare ecosystem of a rural community is anchored by the hospital. When the anchor is pulled, the ecosystem drifts apart, and reassembling it would require rebuilding not just the hospital, but every ancillary service, every professional relationship, every referral pathway, and every piece of institutional knowledge that was accumulated over decades of serving that community. That reconstruction, even if attempted, would take 15 to 20 years and cost hundreds of millions of dollars. And nobody is going to spend hundreds of millions rebuilding a rural healthcare system in a county with 15,000 residents. The economics do not support it, which means the closure is permanent in practice, even if it is theoretically reversible in concept. And the 734 rural hospitals at risk represent communities where approximately 46 million Americans live. That is 14% of the population. 1 in 7 Americans lives in a community where the hospital that serves them could close in the next 12 to 24 months. And every closure in the next 90 days moves that number in one direction: higher. The trust between Americans and their institutions is breaking, and trust once broken at this scale takes a generation to rebuild. Consumer confidence dropped to recession levels in December 2025. 1/3 of Americans think their finances will worsen in the year ahead, according to Bankrate. 7 in 10 are struggling with food, housing, and healthcare, according to CBS News. And the World Economic Forum's Global Risk Report for 2026 found that 50% of over 1,300 experts worldwide anticipated either a turbulent or stormy outlook, with a 14 percentage point increase in pessimism compared to last year. And the breakdown of trust is not confined to the economy. It extends to every institution that Americans were taught to rely on. Trust in the healthcare system is breaking because people are losing coverage, hospitals are closing, and the agencies that were supposed to protect public health, the CDC and the NIH, have been gutted by 4,300 and thousands of positions, respectively. Trust in the banking system is breaking because the big banks pay 0.01% on savings while charging 22.76% on credit cards, and the FDIC insurance limit has not been adjusted in 16 years, and commercial real estate losses are hidden on bank balance sheets through extend and pretend accounting that the New York Fed itself has called a buildup of financial fragility. Trust in the food system is breaking because prices are 26% above 2019 and heading 12 to 18% higher while SNAP is being cut and the government eliminated the tool that tracks food access. Trust in the housing system is breaking because insurance premiums are surging 30 to 60%, property taxes were assessed at peak values that no longer exist, and the total cost of home ownership is increasing by $400 to $800 per month on people whose mortgages are fixed. Trust in the political system is breaking because the largest cuts to basic needs programs in American history were signed on Independence Day to fund tax cuts. And the most painful provisions were deliberately timed to take effect after the midterm elections so that the voters who bear the cost cannot hold the people who imposed it accountable until after the damage is done. And trust, once broken at this scale, does not return quickly. The trust that was destroyed in 2008 took a decade to rebuild, and even then it was rebuilt on a foundation of extraordinary monetary policy, zero interest rates, and quantitative easing that created the asset inflation and income inequality that produced the affordability crisis we are living through right now. The trust that is being destroyed in 2026 will take even longer to rebuild because the mechanisms that were used to rebuild it last time, low rates and monetary stimulus, are no longer available without reigniting inflation. There is no policy tool left that can simultaneously restore trust, reduce costs, increase wages, and stabilize the financial system. And the absence of that tool means that the trust destruction happening in the next 90 days is not a temporary condition. It is a structural change in the relationship between the American people and the institutions they built. And structural changes do not reverse on their own. They require conscious, deliberate, sustained effort over years. And nobody in Washington is making that effort because the midterm election is in November and the incentive structure rewards short-term messaging over long-term rebuilding. And here is the consequence of trust destruction that affects your daily financial life. When people lose trust in the banking system, they withdraw deposits, which weakens the banks, which triggers the very failures they feared. When people lose trust in the healthcare system, they skip preventive care, which leads to more expensive emergency care, which drives up costs for everyone. When people lose trust in the food system, they stockpile, which creates shortages, which drives up prices, which validates the distrust. When people lose trust in the political system, they disengage, which allows the people who broke their trust to continue operating without accountability. Trust destruction is a self-reinforcing cycle, and every cycle that completes without intervention makes the next cycle harder to break. and the cycles that begin in the next 90 days will be the most destructive in a generation because they are occurring simultaneously across every major institution. Not one system failing, all of them weakening at the same time, and a society where trust in every institution is declining simultaneously is a society that is losing the social cohesion that allows it to function as a collective enterprise. That cohesion is invisible when it is present. You do not notice it when it works. But when it breaks, you notice immediately because nothing works the way it is supposed to. The hospital is not there. The bank is not safe. The government is not helping. The food is not affordable. The insurance is not covering. And the neighbors who used to help each other are too consumed by their own survival to help anyone else. That is what trust destruction looks like at scale. And it is happening in the next 90 days. The middle class is being permanently restructured, and the families who fall out of it in the next 90 days may never return. Fannie Mae calculated that for housing affordability to return to 2016 to 2019 levels, home prices would need to fall 38%, income would need to rise 60%, or mortgage rates would need to fall to 2.35%. None of those is happening, and the families that are currently in the middle class, defined by income, by home ownership, by health insurance, by retirement savings, by the ability to absorb a $1,000 emergency, are being pushed out of it by the simultaneous increase in every cost category. Insurance premiums doubled for 20 million people on January 1st. Gas went to $5. Electric bills surged to records. Grocery prices are heading 12 to 18% higher. Credit card debt is at $1.21 trillion at 22.76%, and only 47% of Americans can cover a $1,000 emergency. And the families that cross the line from managing to not managing in the next 90 days will discover that crossing back is exponentially harder than crossing over, because the credit card debt that accumulated during the crisis compounds at 22%. The credit score damage from a missed payment takes years to repair. The retirement contributions that were paused during the emergency cannot be retroactively made. The compound growth that was lost on those missed contributions is gone permanently. A person who pauses $500 per month in 401k contributions for 12 months at age 55 loses approximately $6,000 in contributions. But with compound growth over the remaining 10 years before retirement, the total loss is approximately $9,000 to $12,000 in retirement wealth. And that loss is permanent. It cannot be recovered. The years are gone. The growth window is closed, and the retirement that was supposed to be funded is now underfunded by $12,000 from a single year of emergency cost absorption. Multiply that by every family that pauses retirement contributions this year because the bills exceed the income. That is a generational wealth transfer failure, not from parents to children. From the middle class to the financial system, the interest payments flow to the banks, the missed contributions never compound, and the family arrives at retirement with less than they planned, less than they saved for, less than they were promised by the system that told them 401k contributions and home ownership and health insurance were the three pillars of middle-class security. All three pillars are being weakened simultaneously, and a structure supported by three pillars does not partially collapse when one is weakened. It completely collapses when all three are weakened at the same time, and the collapse is not dramatic. It is quiet. It happens inside the home where nobody sees it. It happens in the conversation at midnight when one spouse tells the other that they cannot make the numbers work anymore. It happens in the decision to stop putting money into the retirement account because the electric bill is $400 and the grocery bill is $1. $100 and the insurance premium doubled, and there is literally nothing left after the necessities are paid. It happens in the realization that the house they bought as their path to wealth is now costing them more per month than the apartment they left because the insurance and taxes and maintenance have added $500 to the fixed mortgage payment. It happens when the 55-year-old who is saving $600 per month for retirement stops saving and starts spending that $600 on credit card minimum payments that do not reduce the balance because the interest exceeds the payment. And it happens silently, because the American middle class has been taught that financial struggle is a personal failure rather than a systemic condition, so they do not talk about it. They do not post about it. They do not ask for help. They absorb the damage internally while maintaining the external appearance of stability, and they carry the shame of not being able to afford the life they were told their income should provide. And that shame is corrosive. It isolates people from their neighbors, their friends, their communities. It prevents them from seeking the assistance that exists because asking for help feels like admitting defeat. And the system that created the conditions for their struggle profits from their silence because a silent consumer continues paying the interest, continues paying the inflated insurance premium, continues paying the reassessed property tax without complaint, without resistance, without the collective action that would force the system to change. Your silence is their revenue model. And in the next 90 days, millions of families will cross from managing to not managing. And many of them will do so silently. And by the time they speak, the damage will be permanent. The retirement contributions will be permanently lost. The credit card balance will be permanently compounding. The credit score will be permanently damaged. And the middle-class identity that defined their sense of self and their children's expectations for the future will be permanently altered. That is what breaks in the next 90 days for the American middle class. Not the label, the reality beneath it. What you can do in the next 90 days to protect what can still be protected. I have spent this video documenting the things that will break permanently in the next 90 days. Hospitals that will close and never reopen. Healthcare workers who will leave and never return. Trust that will shatter and take a generation to rebuild. Middle-class families that will cross a line they cannot cross back. And I refuse to end this video without telling you what is still within your power to protect. Because even in a system that is failing, the individual is not powerless. The individual is the last line of defense for their family, and that defense begins with action. First, if you live in a rural community, identify the nearest hospitals and emergency facilities that are not at risk of closure. Know where you would go if your local hospital closes. Have that plan before you need it, because when you need it, the time to plan is gone. Second, secure your health care access now. If you are on Medicaid, document your work status or exemption before the verification letters arrive. If you are on the ACA marketplace, pay your premium on time every month because a lapse in coverage can trigger a loss of your plan that takes months to restore. If you are uninsured, explore every option available, community health centers, charity care programs, state programs, because entering the fall without coverage is entering a minefield without a map. Third, protect your retirement contributions at all costs. I know the budget is tight, I know every dollar is spoken for, but the retirement contribution is the one expense that creates future wealth. Every other expense is consumed the moment it is paid. The mortgage payment keeps the roof on. The grocery bill keeps the family fed. The electric bill keeps the lights on. But the retirement contribution is the only payment that grows, and pausing it even for 6 months creates a permanent loss that cannot be recovered because the compound growth that would have occurred during those months is gone forever. If you cannot maintain your full contribution, maintain half. If you cannot maintain half, maintain something. Any amount that continues compounding is better than zero. And I want to be specific about why this matters so much for Americans over 50. The math of compound interest is exponential, not linear. The last 10 years before retirement are when the largest balance generates the most growth. A person who has $200,000 in their 401k at 55 and contributes $500 per month with a 7% average return will have approximately $365,000 at 65. A person who pauses contributions for 12 months at age 55 and then resumes will have approximately $353,000 at 65. That is $12,000 in permanent wealth destruction from 1 year of paused contributions. Nobody will send them a bill for it. Nobody will tell them it happened. They will simply arrive at 65 with $12,000 less than they would have had. And for the families being forced to pause right now because the summer cost surge consumed every available dollar, that $12,000 is the invisible tax the affordability crisis levies on their retirement. Fourth, eliminate every dollar of unnecessary spending and redirect it toward your emergency fund. The families that survive the next 90 days without permanent damage are the families that enter the period with a cash reserve, however small, that can absorb a shock without triggering credit card debt accumulation. And fifth, Vote. Register if you are not registered. Verify your registration if you are. Know when your primary is and when the midterm is, because the ballot box is the only mechanism remaining to change the trajectory that is destroying the institutions your family depends on. I want to close with the thought that brought me to make this video. Some things in life are temporary. A job loss, a medical bill, a bad quarter in the market. They hurt, they cause stress, but they end. You recover, you rebuild, you move forward, and some things are permanent. A hospital that closes, a healthcare worker who never returns, a community that loses its anchor institution, a retirement account that never compounds the contributions that were missed, a generation of children who grow up without access to healthcare within an hour of their home. Those things do not end. They do not recover on their own. They do not reverse. They become the new reality. And the next 90 days are the 90 days in which several of these permanent changes will occur. Not because a natural disaster struck, not because an enemy attacked, because a law was passed, a budget was cut, a hospital was defunded, a workforce was laid off, and a community was told that the $50 billion set aside for rural healthcare transformation would be enough. And it was not enough, and the people who made the decisions that led to these permanent changes will face the voters in November. And the voters will decide whether the trajectory continues or changes. But the hospitals that close between now and November will not be reopened by the election results. The nurses who leave will not return because of a ballot. The emergency departments that shut down will not be restored by a new Congress. What is broken in the next 90 days stays broken. And the only question that matters for your family right now is, what can you still protect before the breaking happens? Protect it. Act now. Today, not tomorrow, because tomorrow may be the day your hospital announces it is closing. And when that announcement comes, the window for preparation closes with it. Share this video with every family in your community, especially the ones in rural areas, especially the ones who depend on the hospital that is at risk, because they deserve to know what is coming, and they deserve the time to prepare for what cannot be prevented and to fight for what can still be saved. Subscribe and turn on notifications. I am tracking every hospital closure, every healthcare workforce reduction, every policy implementation, and every economic indicator that affects your family in real time. No spin, no agenda, just the permanent truth about what is being broken and what can still be protected. Take care of yourselves out there. Protect your families. Protect your communities. Protect the hospitals, the workers, the institutions, and the bonds that hold your community together. Because the next 90 days will determine which of those survive and which do not. And once they are gone, they are gone. Not for a season, not for a cycle. Forever. Use the 90 days. Every one of them matters. Every one of them is a chance to protect something that cannot be protected after it is broken.